Hi, my name is Pam. I'm an RN and be doing a physical assessment today. Should take about 10 to 15 minutes. Can you please tell me your full name?
Brian Molnar,
And what is today's date?
April 24th, 2017,
And where are we located right now?
Little Rock, Arkansas.
And what's your full-time occupation, Mr. Bowman?
I'm in the military.
Okay. So the patient is alert and oriented to person, place, and time. So before I do any assessments, I'm going to go ahead and wash my hands. Performing hand hygiene reduces the risk of transmitting germs. Your vital signs were all normal today. Your heart rate was 66 beats per minute regular. Blood pressure was 116/80, which is normal. Respiratory rate was 12, and your temperature was 98 degrees Fahrenheit. These are all normal vital signs. Do you have any questions about these?
No.
Okay. So just general inspection. Skin appears to be uniformly pink. Do you have any rashes or lesions at this time?
No.
Do you have any tattoos on your body?
One on my right arm.
Okay. So the first exam we're going to do is going to be of the head and neck area. Patient is normal cephalic. Scalp is intact, pink. Hair is uniformly distributed, dark brown to gray. They're slightly oily, fine. There are no parasites or lesions noted. Facial features are all symmetric. The neck appears to be symmetric. So I'm going to go ahead and assess the carotid arteries one at a time. Then I'm going to go ahead and auscultate the carotid arteries as the patient holds his breath. Okay. So when you're auscultating the carotids, you are assessing for any breaks, which there are none present. If there were, you would be concerned about possibly an enlarged thyroid gland. His carotid arteries are equally strong. Rate is regular bilaterally. So the next thing I'm going to do is look at the lymph nodes. So we have the preauricular, the postauricular, the occipital, the superficial cervical, tonsillar, posterior cervical, the deep cervical, supraclavicular, submandibular, and submental lymph nodes. There's no lymphadenopathy present today on his exam. So the next thing we're going to look at is the facial features themselves. I'm going to take a look at your eyes. Just look at me. And follow. Okay. Do you have any tenderness here?
No.
So there's no pain or tenderness on his frontal or maxillary sinuses. Can you open your mouth for me? Say ah.
Ah.
Look in your ears. Any pain, tenderness here?
No.
Okay. So the eyes have no drainage. Their pupils are equally round and reactive to light and accommodation. His nose is midline. There are no deviations. Nares are both patent. His mouth, the lips are pink and moist. Looking on the inside, the gingiva and the buccal mucosa are both pink and moist. No lesions noted there. The uvula is midline. He does not have tonsils. On the dorsal side of the tongue, he has the roughened papillae, and the ventral side is smooth and glistening with the vessels present, and there is saliva present. On the inspection of ears, there are no foreign bodies noted in the outer ear. There's a small amount of cerumen on the inner ear that I can see. If I had an ophthalmoscope, I would be looking into the eye to look at the different structures such as the optic disc, the retinal nerves, the fundus, and the macula to make sure these were all within normal limits. With an otoscope, I would be able to visualize the tympanic membrane of the ear or the eardrum, make sure that it is intact. It should be a shiny gray translucent color. Okay, and at this point, we're going to go ahead and take a look at the thorax and lungs. So I'm going to have the patient go ahead and remove his shirt. Just on visual inspection, skin appears to be intact, no rashes or lesions present, everything pink, warm and dry. So I'm going to assess the spine, which is intact, midline, and is S-shaped. And the AP to transverse diameter is 1 to 2. Do you have any pain
No.
anywhere? Okay, can you take a deep breath for me? Okay. I'm going to go ahead and auscultate the posterior chest. Deep breath. vesicular breath sounds are heard in the peripheral lung fields greater on inspiration than expiration. So I'm going to go ahead and listen to the anterior chest. So breath sounds are equally clear bilaterally. There are no adventitious breath sounds. We would also percuss the lungs. For resonance noted. The next thing we're going to inspect is going to be the cardiovascular system. So I'm going to go ahead and transilluminate. Okay, there are no pulsation, lifts, or heaves noted. Ideally, I would have the patient on an exam table and have him lying supine for this exam. EMI is not palpable. So the landmarks that we're going to be looking for in this exam are going to be the intercostal spaces, which are the spaces in between the ribs, the sternal borders left and right, and then the midclavicular line. So when you're listening to the heart sounds, when you hear the aortic sound, which is the aortic valve, that's going to be heard over the second intercostal space, right sternal border. Pulmonic valve, you're going to hear that over the second intercostal space, left sternal border. For the tricuspid valve, that's going to be fifth intercostal space, left sternal border. Mitral valve is fifth intercostal space, midclavicular line. Erb's point is going to be third clavicular intercostal space, left sternal border. So I'm going to go ahead and listen to his heart sounds. So he has a regular rate and rhythm. There are no extra heart sounds heard, no murmurs heard. So when you're listening for the S1 sound, you are hearing the mitral and tricuspid valve. When you hear the S2 sound, that is the aortic and pulmonic valve. And then S1 and S2 are equal at Erb's point. So the next exam we're going to be doing is of the abdomen itself. So on visual inspection, you always want to inspect, auscultate, percuss, and then lastly do any palpation. So his skin is uniformly pink, intact, warm and dry. Hair is evenly distributed on the abdomen. I'm going to go ahead and transilluminate here. And there's no visible peristalsis or pulsations noted. So I'm going to go ahead and listen to his abdomen. And he has bowel sounds present in all four quadrants. If you were to percuss at this point, you would palpate in the right upper quadrant of the abdomen here. You're going to have the liver and the gallbladder present. Left upper quadrant, you're going to have the stomach and spleen. Left lower quadrant, the descending and sigmoid colon. Right lower quadrant, you have the cecum and appendix in these areas. So his bowel sounds were active times 4. The last thing we're going to be assessing is the peripheral vascular system. So I'm going to visually inspect the skin. Everything appears to be pink and intact, warm and dry. I'm going to look at the nails on both sides and also the nails of the toes. So the nails are convex, neatly trimmed, translucent. The cap refill is less than 3 seconds bilaterally in upper and lower extremities. I'm going to go ahead and inspect the radial pulses bilaterally and the brachial pulses bilaterally. I'm going to go down here, and so you can see, we're going to look at the dorsalis pedis pulse and the posterior tibial. So I'll do that on each side to assess that both are equal, and in his case they are equal in rate and rhythm and an amplitude of 2. So this is all normal. I'm also going to assess the skin here on the shins. Everything looks good. Hair is evenly distributed. There is no edema noted, no shininess to his shins. So that concludes our physical assessment for today.